this one.
Good morning, everybody. We're going to get started this morning. Thank you all so much for being here. My name's Ileana Kniss, and I'm the Director of Development Community Relations for Peace River Center. And we welcome you today to our Mental Health Matters series, Mental Health in the Workplace. We have some people on Zoom joining us today, so I want to welcome our Zoom participants as well. Thank you so much for joining us today. Peace River Center, one of our goals is to create awareness surrounding mental health topics and destigmatizing the topic of mental illness. So today we are here during Mental Health Awareness Month to share some information with you and help you learn some facts, some myths maybe, and what things we can do to help those individuals that are around us who may be affected by mental illness. So thank you all again so much for being here. I do want to recognize Polk Vision. I don't see Kim, but Tara and John Michael are here with Polk Vision. And of course, Alice Nuttall and Holly Vida, who's with the Polk Health Behavioral Team Committee. They help bring this study together along with some partners in our community. And today, Alice is going to give us a little bit more information about that. But I also want to recognize Florida Blue Foundation, who gave us the opportunity to provide these series for free at no cost to you. But we also are required to record who participated in these events. So you'll see a sign-in sheet at your table. If you could just please put your name on that list so that we can keep track of the numbers that have participated as part of our Florida Blue grant. I also want to recognize Sunshine Health, who also afforded us the opportunity to provide this at no cost to you. So now I'm going to introduce Alice to come up and share with us the behavioral health study, some facts about that, and then she's going to introduce our panel speakers. So Alice is an MBA, RN, and BA in transformational behavioral health leader and nursing executive, providing her expertise to patients and colleagues for over 20 years. A graduate of Vanderbilt University with a degree in neuroscience psychology, Ms. Nuttall also has degrees in nursing, healthcare, and business management. She is both passionate healthcare leader and skilled businesswoman who fosters collaboration on the most difficult of community-wide issues. She is currently an AVP of Behavioral Health Services at Lakeland Regional Health, and she returned to her hometown in Lakeland of 2018 to lead efforts in building a new state-of-the-art 96-bed behavioral health and wellness center that opens in this year. Wow. LRH is growing best-in-class behavioral health program with an entire continuum of care and robust connections through the community. Ms. Nuttall is actively collaborating with local law enforcement, first responders, social service agencies, and local government to raise behavioral health awareness, increase access to services, and reduce the stigma for those with mental health disorders. What a great partnership we have today. She sits on many boards with focus on wellness of the community and is a sought-after speaker in the area of emotional wellness, emotionally intelligent leadership, and behavioral health. So please help me in welcoming Alice Nuttall.
Thank you, Ileana. And I really do have to say a tremendous thank you to Peace River for helping us host these events. And we have just had tremendous collaboration and help from our Polk Vision team as well. And this really is, I'll get to the punchline to really say, we launched upon this study over a year ago now and engaged many, many different participants and community groups. But really the goal was to do this, what we're here today to do. It was to get together and to continue this conversation as one large community. Many of us here, I even see the wonderful smiling faces here in person. Those of us that are on the panel today, we come from many different walks of life. But the thing that we have in common is that mental health and behavioral health issues, they're important to us. And for all of us here in Polk County and really in Central Florida, if we're going to make an impact that is lasting in these topics, whether it be in the workplace, whether it be in your homes, your schools, or our neighborhoods, it's going to be together. And that's really the mission of Polk Vision. One of the reasons why I'm so proud to be a part of Polk Vision is it is all about alignment. It's about coming together and having some really hard conversations around topics that can be uncomfortable. The study that we launched upon, we really are proud of the final product. It is on the website if you want to actually see and read through that. It has some really neat dynamic information. There's a wonderful location guide that has services, how to find those services. We not only went through and looked at all the things that are going right, we looked at all the things that are going wrong or not working. And then we went a third step within our behavioral health study here at Polk Vision, where we prioritized. We started to break down really, okay, and this was through multiple rounds of community engagement sessions, all via Zoom, but we had wonderful participation by people from all walks of life. And really, when you got down to it, some of the most important things that we need to do in this county, number one being break down silos, having conversations cross agencies to tackle really hard, wicked problems. It was to focus on those that are underserved. So our youth or people that are underrepresented, our homeless and unhoused communities. It was to also really look at the crisis stabilization or that mobile crisis piece. How can we collaborate further with our first responders, making sure that we break the cycle of people always having to enter the system in crisis, but also how can we make sure that we're following up on individuals better and looking at all kinds of ways. So really proud of that study, and that study is really why we're here today. I do want to mention Scott Good and Tara O'Clair. They were our partners through Crescendo, who is a third-party group that came in and really helped us run the study and do the analysis and some of the real tedious data and statistical analysis. And Scott really wanted to be here today. I know he's here with us in person or in spirit, but he was unable to attend at the last minute. So I'm actually going to take his slide deck and do some of the introduction here, but they really are an essential piece of that story. We're very grateful to our Crescendo partners. I also want to just take a quick second, and before I launch into the slide deck, introduce my panelist up here. We're really excited to have Alex Garcia-Barbon, who's the Vice President Behavioral Health at Advent. Alex currently serves the Behavioral Health Services for Advent Health Central Florida Division. Prior to joining Advent, Alex served as Vice President of Operations at Horizon Health, a leader in the management of behavioral health service lines and programs. In that role, he collaborated with health systems and independent hospitals to successfully manage their existing behavioral health services or effectively set up new services. He's also worked as the Chief Hospital Officer at Lifestream Behavioral Health, where he oversaw inpatient and emergency services for the organization. Throughout his career, Alex has gained an extensive experience in behavioral health programs and development, and he is a very passionate behavioral health leader. So we're really grateful to have him here with us today. He also holds a master's degree in international management and healthcare administration from the University of Maryland and a bachelor's degree in theology from Washington Adventist University. So Natalie, here in the center in the lovely yellow, Natalie is the manager of EAP services at Publix supermarkets. She currently is working as the manager over there. And prior to Publix, she served as labor relations specialist and survey project analysis also with Publix. In the past, she worked with the city of Lakeland since 2009 as an HR generalist and specialist. She previously served with the American Cancer Society in talent and development and was an HR rep for the University of Central Florida, also her alma mater. Natalie has her bachelor's and master's degrees from UCF, and she is PHR and SHRM-CP certified and has been a chapter membership with the Mid-Florida SHRM since 2011. So we have a really neat informed and educated HR professional to talk with us today about mental health matters in the workplace. Very grateful for Natalie. And Donna Rittinger, she is a director of specialty services at Peace River Center, and she is a licensed mental health counselor and master's certified addiction professional. She has worked at Peace River Center for she's like 32 years to be exact. I confirmed that with her this morning. So what an amazing advocate and behavioral health leader. She has been on the front lines for many decades here, and we're very, very grateful for her. She's held several different positions, including victim services, case management, child advocacy center, children's therapist, assertive community treatment, addiction services, family intensive treatment, forensics, and the children's action team. She currently serves as Director of Specialty Services, and Donna is trained and certified in various evidence-based therapy techniques and serves as a consultant and a trainer for those becoming certified in EMDR, or eye movement and desensitization reprocessing therapy. She's also a mental health first aid trainer for the community, so we're really grateful to have Donna here with us today. Kind of work on that. Oh, there we go. Too far. Okay. So as we've sort of already shared, and you can even hear from these amazing careers that I've just announced here today, there is a story to tell around mental health, not just here, but across the nation and across the world. So we know that particularly we're really going to focus on things that matter in the workplace. And the numbers that we see in the community and that we see in crisis stabilization units, these are the same people that are your team members. These are the same people that show up to work at our various agencies and schools and communities on a daily basis. 1 in 5 adults, 1 in 5. So just look to your right and left. Think about the last 5 individuals that you have interacted with on your cell phone over the last 24 hours. One of those individuals is likely to be suffering from some type of mental health condition or diagnosis that really deserves help. We know that many people have symptoms such as stress and headache, feeling overwhelmed or anxious in the past 30 days. We also know that people in our places of work that have unresolved mental health conditions or things that due to stigma or lack of access or being underfunded or making a phone call and not being able to actually find someone to pick up the other line, whatever the barrier may be to them receiving help, we know that they're not going to be as engaged, they're not going to be as productive, as creative on many, many challenges that we have in the workplace today. So we've had significant population increase here from 2010 to 2020, 13%. And I can't even imagine if we were to run these numbers, even in the last 6 months. All of these, as we know, in our schools, law enforcement, healthcare, our services in the community are being stretched. Behavioral health is no different. We were already, prior to this significant population surge, already having a lack of mental health professionals. Really, you kind of see, and I'm not going to remember the exact numbers, but it's around 1 to 310 is the average ratio, like a national benchmark for behavioral health professionals. In Polk County, I believe right now we're at 1 professional to every 1,140. That is too many patients to serve for our providers. There's a reason why it's hard to get through to people. Many don't seek care. And the reasons I've already kind of alluded to, there's several reasons, but if our employees and our team members aren't getting help, they're not at their best. And so when, again, we wake up in the morning and think, I'm a banker, or I'm a teacher, or I'm in the, professional sports economic business here, you don't necessarily think that part of the things that I need to worry about on a daily basis are mental health. But that's part of the conversation we're starting here today, is it really does need to be something that we all think about. So poor mental health and stress can affect productivity, engagement, communication, physical capabilities. If you are struggling with a lot of stuff under the surface, it takes a lot of energy and emotional labor just to show up and meet the basic requirements. But I think that you would agree with me, in today's world, particularly after the last 2 years with COVID and the initial both business demands, policy changes, all of the healthcare struggles and the things that we have dealt with, with our schools, the problems we are all facing to solve are actually more complex than they have been before. We don't have rule books to know how to do a perfect marketing plan post-COVID. How do you run community events safely, right? We're needing to be, and our world is demanding of us that we be more creative and more present. But yet at the same time, many of the people that are in charge and responsible for these initiatives in our community are struggling under the surface. And maybe they haven't been able to reach out for help. So one of the things we want to leave you with here today, and that we're going to get to hear from our fine panelists really talk about, is that employers can't afford not to support mental health. And it's going to look different based on the size of your organization or the size of your team. You could have a small little group of volunteers, but there are ways that you can integrate and pull in a thread of behavioral health and mental health wellness. Or you can be a part of a massive organization, like the school board or the hospital. These entities, it's on a different scale, but we all need it to be on our agenda. So the data about depression and productivity is dramatic. And we see that 80% of employees treated for mental illness actually report improved levels of work effectiveness and satisfaction. So how can we as employers start to break down some of these barriers? Some of it is just about awareness and conversations. It may not necessarily be, launching your own EAP, but there are other things that also include more tangible resources. We know that employers that support mental health, they see a return of $4 for every dollar invested in mental health treatment. So this was something that I really wanted to make sure that Scott and our team brought up today, is that for people who are very business oriented and looking at the bottom line on a daily basis, this is an important topic. All your other key performance indicators are going to perform better if the mental health of your workforce is a priority in your strategic plan. And why is that? Because think about the number one reason in the nation for short-term and long-term disability is mental health diagnoses. Raise your hand if you've been on a team that have individuals that are out on disability. That can be an impact to productivity and the ability to complete and execute on very important things with your plan or your work team. We know that, again, if communities invest in mental health, this financial return is not just in productivity in the business space, but it is also in a decrease of resources needed. If we're dealing with mental health needs early, it's going to be less crisis services from a law enforcement standpoint. There's going to be less disruption in the classroom. There is going to be less missed work. There are a lot of other impacts. It really trickles out. There's a ripple effect if we invest in mental health early. So how do we manage stress in the workplace? I may come back to this slide because I'm really excited and I don't want to delay any further launching into some of our questions with our panelists. But we know that a mentally healthy workforce is good for business. I am going to pause. Can you guys help me just put the slides on pause so that we can move into part of the transition? I may come back to these slides to kind of wrap us up at the end, but I really want to get to some of the good information from our panelists. Perfect. That's great. Okay, so I've introduced our panelists. We've sort of set up the topic of why it's so important to have mental health be an important topic for all of us. And we know the last thing I wanted to really go over for you with, well, what is mental health in the workplace and what does it entail? So we know that mental health is a person's condition in regard to their psychological and emotional well-being. Mental health is going to depend on both internal and external factors. It also is going to rely on the culture and the environment of the workplace, the team dynamics, and things of that nature. Have you seen a picture of the duck on the water? Think about it. We see them all the time on Lake Morton, right? You see them, they look so peaceful, gliding around. Underneath, there's a lot going on. And we know that that's the case with so many of the people that we interact with on a daily basis in the world. So when you talk about mental health, it both entails the things underneath the surface and on the outside, the things that are going on at home and in our relationships and in our team relationships. But what is the most important thing for us as leaders and as people who are committed to this topic is that we take care of the whole person and that we commit to a culture of including mental health. So I'm excited to ask now, Alex, I'm going to ask you the first question. Why is mental health an important concept for the healthcare workforce particularly, and especially on the heels of COVID? I know it has been a very relevant topic. So share with us a little bit why you think it's so important we take care of that for our healthcare workers.
No problem. Welcome, everyone. Thank you for having me. Thank you, Alice, for the invitation and everything. A pleasure to be here. I'm on the upswing of a sinus infection. It's not COVID. I've been saying that since yesterday because people are like, you sound sick. But anyway, so why is mental health so important? It is sad. I've been in behavioral health for 23 years. And it is sad that we still have to explain why mental health is important. That is very sad. It is important because it's part of health. It is important because if this is not working properly, nothing else will work properly. It is important because mental health is part of health. And what if you remember something after today's hour and a half discussion, what I would like for you to remember is that your employees, your coworkers, your neighbors, your family members, your kids, your teachers, everybody around you, everybody around your community has mental health. That everybody around you may suffer some illness of mental health. That people are not talking about it, that people don't feel comfortable saying, hey, I'm not feeling well. I'm crying more than usual. And it's just not that I'm sad. Because people confuse a lot of, oh, I'm sad versus depression. Mm-hmm. Oh, I am anxious. I can't sleep. I can't get out of bed. I got to push myself to get out of bed. I don't want to go to work. Let's not confuse that. Let's think about it as is everything all right? Are things going okay? Are things happening properly? Remember that the brain is the only organ of your body that is capable of producing chemicals. It's the only one. And when there is a chemical imbalance in your brain or in somebody's brain, that's when everything begins to not work properly. So the question that I always ask is, if you are looking at your computer screen and all of a sudden you are seeing blurry and you're not seeing well and you're getting headaches, what do? You go to a doctor, but you don't go to any doctor. You go to the ophthalmologist, right? Why? Because it's the specialist for your eyes. Why is it, and I continue to ask myself this after 23 years of being in behavioral health, I'm preaching the same sermon, I'm preaching the same thing every time I speak. Why is it so difficult for us to understand that when my brain is sick, I need to go to the specialist of the brain? I need to go to a psychiatrist, and then it's okay to go to a psychiatrist without people thinking that I'm crazy. And we continue to talk about stigma, and we continue to talk about how do we destigmatize mental health? Well, it's our job, it's us. Mm-hmm. That even us in behavioral health, we continue to stigmatize, we continue to treat it differently, we continue to have to prove to people why you should care about behavioral health, why you should care about mental health. COVID has done one thing positive, and that is that mental health has become a subject that it's spoken at dinner tables. That mental health, it's okay to not be okay. That people during COVID began to express and began to talk about how do I feel lonely? I feel sadder than usual. I feel a little depressed. Maybe I got to take that self-assessment, those 10 question self-assessment, and see that I feel depressed. you know what's interesting? What's interesting is that 90% of prescriptions for mental illness are prescribed by your primary physicians. 90%. And the reason for that, Alice, is that we have in our minds that mental illness looks just like once in the cuckoo's nest. That's what we think about mental health. If you have mental health issues, you should be in a four straitjacket. You should be institutionalized. You are the one that is walking around talking to themselves, no shoes, wearing the same clothes and talking to themselves and running and really absurd behavior. And that's what we think about mental health. That person really needs help. But the great majority of people that are in our inpatient settings, they're not the acute psychotic patient. It's the patient with the depression that cannot get out of bed. It's the patient with the anxiety that it's hard to go to work. It's the mother that can't go to drop their kids off at car line because if she doesn't have that drink, she can't deal with the day. It's the father that it's coming home and is just going to bed without interacting with their kids because they're depressed. Those are the individuals that, the majority of the individuals that are in our inpatient setting. Yes, and like we were talking, yes, there is a need for inpatient beds because there will always be acute patients that need stabilization care. But the great majority of patients need an outlet and need a system of care that deals with them on an outpatient basis.
Alex, you said that people were really resistant and hesitant to sort of talk about this or bring this up. And how have you found that to be within working with physicians and nurses and CNAs and our other healthcare professionals? Do you feel like that they are sometimes the last people that want to actually pick up the phone and ask for help?
Most definitely. It is interesting, for a lack of a better term, that in the healthcare field, when you look at and you experience this all the time in the hospital, it's the ED physician, the emergency room physician, the emergency room nurses. When a patient comes in and a patient has a mental health diagnosis or a substance use disorder diagnosis, all of a sudden that patient becomes your patient. That patient becomes behavioral health patient. It's not our patient because we don't know how to deal with them. You know, when I talk to physicians and when I talk to healthcare workers that look at behavioral health issues and look at mental health and substance use issues as it is not my issue, it is not my problem, it is their problem. Their bones are broken and they have wounds, but you don't see the blood and you cannot see the broken bones. And if we were to just look at patients with behavioral health issues the same way that we look at patients that are coming with the wound and are bleeding, where we can see that wound, that are coming and we see the broken bone through an x-ray, we just need to look at patients with behavioral health issues the same way. We just don't see the blood. We just don't see the wound. We just don't see the broken bone. But that patient, it's bleeding, and that patient has broken bones.
So after here, we've, faced this really, really difficult frontline fire, if you will, in dealing with the pandemic. Many of our healthcare professionals are in some ways the walking wounded. They continue to show up every day. They were called to continue to care for our community in multiples of ways and fashions. But it was more important than ever that we start to really focus on how do we take care of the healthcare workforce. I know numbers in 2019 for a national survey showed that nurses and physicians, 1/3 of them were in a clinically diagnosable state of burnout. And when you're in a clinically diagnosable state of burnout, you're going to make more errors. You're not going to be as engaged. You're going to kind of be robotic in how you perform your duties. And so I know it's not just a heart thing that we want to do to take care of people that we work with, but it's also a very important business thing for an organization. How has Advent made that a priority within your system? What have you done to take care of your healthcare workers?
I'm going to give a statistic, because this is a statistic that we had to look at really carefully in order to make an investment for mental health for our nurses and for our team members. Do you know that 38% of nurses, nursing is 38% more likely to be suicidal than any other profession, to have suicidal thoughts than any other profession. And about a month ago, I got a call on a Saturday. It was Saturday around 7:10. And it was one of our chaplains and one of our CEOs from one of our hospitals called me and said, "We need your help and we need your team's help." It was Saturday, 7 o'clock, end of shift. And in one of our ICU units, one nurse that had been working there for about 12 years, a mother of an 8-year-old, couldn't be found. Her teammates, her team members, her coworkers could not find her. And like around 7:05, they went to the staff bathroom. They couldn't open the door. They pushed the door open, and the nurse was just laying there. She had committed suicide at the end of her shift. And it came as a surprise, but not as a surprise, because she's not the only one. There are a lot of nurses. There are a lot of healthcare workers. And let's just not talk about nursing. Let's talk about your environmental services, your dietary services, your CNAs, your techs, your physicians that have gone these 2 years dealing with COVID patients, seeing death every day, seeing families not being able to say goodbye to their loved one, being the one that it's holding the hand while the patient dies, seeing all these things for 2 years. And yet, let's throw this in the mix. And now you have the whole shift on the industry to travel nursing, where now the one that used to be your team member, your coworker, has decided to go to travel nursing and now comes back to work with you, but it's making 3 times as much as you are making. So you throw all that in that mix, and you have the worst case scenario for an employee that you need, because doesn't matter how many doctors you have. If you don't have nurses, there's no health care. There is no health care without nurses. So what we have done is, and I can talk about that for a long time, but let me answer your question. What we have done is we have made a substantial investment in creating what we call the Team Member Mental Health Initiative. And what that is we have employed licensed mental health clinicians, and we have developed a team where we have a licensed mental health clinician in each of our hospitals. And for example, in our Orlando campus, which is a 1,500 bed hospital, we have 4, because we have the adult, the children, and the women's hospital. We have 4 mental health consultants, and their whole job is to check in and round the medical units, not for the patients, but for the team members. Their whole job is to attend morning huddles for the nursing departments, to attend shift change huddles, to attend staff meetings, and to check in with each employee, to check in with each team member about just asking the question, how are you doing? And it's not about diagnosing depression, anxiety, PTSD, bipolar. It's not about any of that. It's about just checking in with them and seeing, how are you doing? Is there anything I can help you with? So what we have done is, and what happens in a lot of the companies, and you can talk a little bit more about that, I think, Natalie, is companies spend a lot of money in providing benefits and a benefit package for employees, but employees are not aware of them. They're really not aware of them. Advent Health has, I mean, I've worked with several health systems, and I think that Advent Health has one of the most robust employee benefit package, but our employees don't know about it. So what we have done is this team member mental health, these mental health consultants are not only licensed clinicians, but they have become experts on what is there to offer our employees. What benefits do we have to offer our employees? And when they come across an employee that needs substance use treatment, or that have a family member that needs substance use treatment, that needs mental health treatment, our mental health consultants are guiding that process and connecting that employee with those resources. And what we have seen is, in 1 year that we have been operating this program, we have seen an increase in team member morale. We have seen a decrease in turnover rates, because our turnover rates with nursing, I know that you're going through it. Every health system is going through it. The turnover rates are super high, especially after COVID. And now, as we are in the downswing, in the upswing of COVID, but they have become experts. So what they do is they guide that individual. Not only they have that conversation, and they can have that conversation and that 10, 15, 20, 30-minute session with that individual, with that team member, but now they're actually extending the benefits and extending the education about what we have to offer to you. So that's something that we have.
That is wonderful. I so appreciate you sharing with us, and what a testament to an incredible investment that Advent Health has made. But I want to point out to you a theme that I'm seeing in this word access. So we talk a lot about in our field access and the lack of, but often if you kind of think of that word first, you're thinking about the individual that doesn't have any benefits, who's kind of out there sort of struggling, when actually it's often just as high of a mountain to climb for someone that has healthcare benefits. Because even if you're dealing with just mild depression, you're not feeling ready or like energized to like dive in and solve a complex problem of finding a therapist. It's not easy access. And so think about our school teachers, our law enforcement officers, all of the many healthcare workers who work for the city government, all people who have really pretty good insurance. But then also, we've made it more complex in behavioral health, because mental health is built on a system of carve-outs. Insurance benefits aren't at face value. If you just pull your insurance card out for your dental or your medical benefits, it's often, even if you do have behavioral health benefits, something that's not on the card, you have to call a third number to receive, and there's a special pre-authorization. Well, for someone who's already kind of hesitant to make that call, that is a big mountain to climb. I'll just mention a few things before I pass it off to Natalie. At Lakeland Regional Health, we have over 6,000 employees. We've had tremendous growth in both outpatient, our inpatient programs, and we have ambulatory centers really all over the county. And we have also found that we could not afford to not address mental health. We have always had services, we've always had benefits, but again, very similarly to Alex shared, our team members weren't aware of them. So we actually did implement we had to have a new vendor for our EAP as of this past January that's a lot more comprehensive. And we have done so much to really promote and get out there and have conversations. We also implemented a peer support, or I'm sorry, a team support chaplain. So we have a really neat team of hospital chaplains, and we have added a new position of a chaplain whose main focus, she also happens to be a master's level mental health professional. She also rounds on teams and is very similar to Alex is saying, is a real expert now in all the resources. She herself as a team member isn't out there to solve problems, but she's to be a listening ear to help people after, whether it be a critical event or a hard day at work, or just low-level stress that happens all the time. She is also a resource to go and present at staff meetings and physician department meetings and grand rounds. And she is really the spokesperson, if you will. And that has been so well received because it's someone that's on our team. They know, they see her on a daily basis in the cafeteria. She also has made a point of coming in on weekends and nights because we have a lot of team members that we're operating with, I know, in all of healthcare. And the other thing that we've done at Lakeland Regional Health to really focus on mental health in the workplace is peer support. And I know many of us in this room in behavioral health, we know about peers historically in behavioral health spaces. They're patients that have dealt with first line mental health diagnoses or substance abuse, but we're actually training our nurses to be peer support for their peers out on the floor. And so we have a curriculum that we have invested in. We have meetings with these individuals. We're really covering every shift. And it has been so well received again, because that's that person that just knows a little bit more information. They're not an expert, but they're someone that the team trusts. And we have shared with the nursing unit that this is your person. If you need help and you don't know what number to call first, go find them. They'll help you and they'll be available to you. So you kind of see some consistent themes, very similar of the barriers and the things that Alex was dealing with over at Advent, very similar, I think, to many, many healthcare organizations. Now, Natalie is here to share with us particularly some of the things that Publix has done to address mental health for your associates. And I'm sure that this was a big topic and issue before the pandemic, but then as the pandemic rolled out, I mean, our Publix and all grocery were really on the first lines as well. Very stressful, type of work wherever you were in the organization. So share with us really some of the things that you did to make mental health initiatives for your folks.
Well, when I first got in the position, it was March 2020, right at the height of COVID. And I was like, we need to do more. We need to do more. About 83% of our workforce is part-time and they don't have access to healthcare or benefits. So therefore, I went to my director, and because we get calls all the time with associates saying they have suicidal thoughts, they don't want to be here anymore, so on and so forth. So I'm like, we need to do more. We can't just say, oh, let me refer you to someone else. So what we did was we started paying for mental health services. My team will connect them with a counselor if they have suicidal thoughts or tried to commit suicide. We'll connect them and we'll get them that help immediately, because it wasn't enough to just give them a referral. It was like, we need to do something else in addition. Also, we partnered with a company called Amwell Telehealth, because many of you know that COVID, everything shut down, including counselors, face-to-face counseling. So therefore, we got with Amwell and we launched a telehealth program. And for as little as $25, associates can speak with the counselor. We also this past January just added psychiatric services to that as well, and it's still $25 copay. So that was one of the main things that we've done. We've also partnered with Mental Health America, and we have toolkits accessible for our associates. It's kind of a proactive approach. So if you are dealing with depression, because let's face it, as Alex and Alice say, we are all on some spectrum here. We all have highs and lows. We all have peaks and valleys, and we all deal with things. So if you're dealing with something, there are some proactive tools out there that they have access to at home and at work to help them through and get them through their lows. So
I love that. I think that's such another silver lining to the pandemic is the incredible dynamic telehealth platform that behavioral health is now, it's now around to stay. As many say, you can't put that toothpaste back in the tube because patients, even, and individuals in our communities, it's so much easier to just be able to pull up your smartphone or your iPad or your tablet on a quick break between work. It makes it more accessible. And kudos to Publix for really making that an easy kind of one call. Now, share with us, Natalie, how many associates do you care for at Publix? And then how many people are on your team?
So my team covers all 230,000 plus associates. Yes, and my team is very unique. So it's called EAP. However, it's not the traditional comprehensive EAP. In fact, we are looking for a provider. So Alice, I'm gonna get but my team, we cover all criminal background checks, we cover all drugs and alcohol, and we also cover the mental health for all 230,000 plus associates. I have a team of 4 EAP support specialists that handle those mental health referrals. So it's a small team. It's for a great deal of associates.
Doing lion's share of the work. Yeah. Well, again, I think it's really neat and important to highlight that for many of you who work in the mental health space or who are employers or in the HR world, the term EAP often is a loaded term because people don't really maybe know all that entails. And as Natalie just sort of illuminated, it can mean lots of different things. There's lots of different shapes and sizes of what, quote unquote, an employee assistance program is. It can be something that an organization actually self-funds. And if they're large enough, like they have an economy of scale, they can actually employ people that provide some type of direction, access, or services that then partner in with their medical benefits. Other organizations actually have a contract with an organization or a team that specializes in EAP benefits. So you'll get an EAP phone number and you'll call, but that person will not be actually working for your team or organization. And then some teams, again, EAPs, because they can be costly, you're not going to find for small, small teams or organizations, they may not have a large formal EAP program, but there are definitely still opportunities out there. Now, Natalie, another thing, as I share with this term EAP, it can kind of be different at different organizations, but it also can be a loaded term. I know, particularly in the years that I've been in healthcare and working with first responders and law enforcement, EAP can sometimes be like the 3-letter word, like, oh gosh, EAP, and kind of get an eye roll. There's some stigma associated because they may have had a negative experience years ago or just heard people talking about it, and you think, my lands, if I'm having the worst day of my life, I don't want to call them. So at Publix, how have you, as a very unique EAP, kind of shaken off, and sort of rebranded or kind of, got out of that stigma, if you will?
Well, as Alex said, it's okay to be not okay. So that's what we preach. It's okay not to be okay. We got the CEO to do a video message to all our associates saying just that it's okay to not be okay. If you have, if you need help, reach out. We also launched on our website access to EAP services to show actually what we provide, because it's underutilized because they are unaware that it's available. So we also sent out mailers showing what's available as well. So I think it's just very important to let them know it's okay to not be okay. And like you said, most companies, they may contract outside, so that EAP provider does not work for your organization, so they may feel a little bit more comfortable with contacting them, but Publix is internal. So we had to think of ways to let them know it's okay to not be okay. If you contact us, we're not going to tell your manager, your supervisor, no one will know, so on and so forth. So
that's a great idea. And that's something that is an idea that all of us can take away, is having someone on your senior leadership team make a video or do a podcast, or even, make a photo, whether they pass it around a social media page, perhaps for your team, that they be vulnerable and say, it's okay to not be okay. Like, you are allowed to be human. So I love that. And then the whole concept of really shaking off and branding whatever it is for your own team, talking about it, making it more accessible is really, really important. So thank you for sharing that, Natalie. Now, Donna, tell us some things that you have done at Peace River Center to focus on team member wellness and mental health. And again, because you have also, our colleagues at Peace River have really been on the front lines of human suffering, anxiety, and stress during the last 2 years.
Well, we try to make sure that staff know about our benefits. We have a wellness newsletter that goes out to all the staff to let them know. But being in the field ourselves, we kind of are able to recognize those signs. And what I have found over the past couple of years is that just naturally the staff started talking to each other. We have the Make It Okay campaign that's going on at Peace River Center that's talked about in our meetings a lot of times. And staff are just starting to talk to each other as all of us can do. You recognize a sign from one of your coworkers and you ask them, are things okay? What's going on with you? And so I noticed that the staff are checking in with each other. One of our campuses, one of our major campuses on the Gilmore campus is close to a lake. And you will see throughout the day, little groups of staff who will take a break and go walk down by the lake and come back. And so just taking time to take a break, step away from your desk for a few minutes, just check in with your other coworkers and staff to make sure that everything's okay with each other.
It's really about wrapping your arms around the people that you work with on a daily basis. Often when you even talk about suicide, and I am like Alex, unfortunately, I have lost many colleagues, not many, but several colleagues in the last 20 plus years I've been in healthcare to suicide, both nurses and physicians. And often you hear families say, I didn't see any signs. They say there's signs, but I didn't see any. Well, sometimes people hold it together for the people they love at home, and the signs that they were displaying before they made such a crucial end of life decision were at work. They were really disengaged or what have you. And we can't, dive right in and say, the first question out of your mouth may not be, are you thinking about committing suicide? But it's, are you all right? What's going on? Like, I care for you, and 9 times out of 10, the answer to that question is like, yeah, I'm fine. I don't need anything. But the fact you asked, it really matters. And we need to have cultures and communities on the teams that we work with. The other thing I wanted to mention real quickly is I've actually been with organizations past historically where I've been in a boardroom with executives looking at the budget for the next year for benefits. And when they have been deciding on the investment they are going to make and the mental health programs for their team members, one of the most important things they look at, and again, hopefully this is an old habit, but it was the utilization report for EAP. How much was it used the year before? Well, because of the stigma and because of word of mouth and people's lack in particularly whatever field or role you're in, people aren't using maybe historically the EAP as they needed to. That's not a good yardstick to look at when you're looking at your investment. What you need to be looking at is your turnover, your engagement, your productivity, your quality standards. It's all of the other things that you're looking at. And you know that if you would make an investment in mental health, these other things are going to continue to improve. The cost that it takes all of us as businesses to onboard and hire new people, if we take care of and really nurture the people we have, it's a good business decision. So in 2019, so these were numbers again before COVID, but some of these big national conglomerate studies take a while to sort of come out. We knew that 35% of the workforce said that they missed 3 to 5 days of work per month due to stress. So not due to strep throat, not due to COVID, but due to stress. 80% of individuals in American workforce said it affected their personal relationships at home. We know for certain that this has increased since the pandemic, particularly due to always having that heightened state of stress and adrenaline and cortisol that affects both our mental and our physical health. So I want us to really take some time now at looking at what are some of the general warning signs when that everyday stress may be kind of creeping to the next level that you need to maybe do more than just say, hey, are you okay? Donna, can you share with us what are some of the warning signs in individuals struggling with mental health?
Well, when you're struggling with mental health and you have all this fear and anxiety, it's difficult to focus. And so the productivity, of course, is going to go down. You may see some absenteeism. You may see people missing deadlines, not being able to complete work assignments. And they may not be getting enough sleep. So you may see some physical signs such as a decrease in being impatient or intolerant, their irritability going up, so their mood. And so all of this then ends up with reduced productivity. And as people struggle with these kinds of things, some people may even turn to substance use as a coping mechanism. And so then you have a whole line of additional types of symptoms that may go along with that. If people are using substances as a coping mechanism and then coming on to a shift at work, you may see some tremors in their hands. You may see their eyes may be bloodshot. You may see an unexplained change in personality. You may notice a sudden significant weight loss, or you may see periods of time where they're very hyperactive or agitated if they're using substances while they're at work. You may notice some suspicious or kind of paranoid kinds of behaviors or trying to hide the use of the substances. And then over time, you may even notice, some unusual smells to either their breath or their body or their clothing as signs. They may be feeling anxious or fearful or paranoid for no apparent reason. So you'll start to see some of those physical signs too as the use continues.
Now, how would you guide really any team member? Because this is a human condition. I mean, this may happen if you're working at the DMV or, at the mini mart down the road, any type of employee. If you were to see these types of signs and symptoms, how would you guide someone to what would their first interaction or first reaction be?
Well, the first step is to start the conversation, to notice that and to just say, hey, are you okay? Check in with them, see how they're doing, and just be present. You want to use your reflective listening skills. They just want to be heard. They don't necessarily want you to fix the problem, but they want to hear you. Know what your community resources here. All of these agencies that are represented here today, as well as there are a lot of other community resources out there. Know what the community resources are. And you never know when those conversations, when you're going to have those opportunities to have those types of conversations. So when you learn about these different resources that we're talking about today, take those numbers and put them in your phone. Most people carry their phones around with them all the time. And since you never know when those conversations may happen, you want to be prepared. And so you want to have those phone numbers ready. And so if you're able to have those conversations with somebody, you can just pull out your phone and you can have those numbers handy. So offering resources and information to the individual and just letting them know that you're there for them and you're present will go a long way.
Can you share just a thought or two? Because again, obviously Donna is an incredibly gifted therapist and has been for many years. And I think sometimes people fail to actually step out and ask that question because I think I'm not a counselor. Like, what if they say something and I don't know how to respond next? But it's okay to just be a friend and a peer in that moment. You don't have to have the right answer. Often it's not the words, right? It's the presence. But can you kind of give us a little bit of a pep talk? So if we're not a Donna, how we do this?
Well, anybody that's struggling with any mental health issue, they feel like everything is out of their control. So if you just encourage them to focus on what they can control, that will go a very long way. And just like I said, being present, letting them know that you're there for them. And if counseling is something that they would like to pursue, a lot of times it's really hard to take that first step. So if you will just offer to accompany them, if that's what they want to do, and to be there for them and let them know that you're there with them throughout the process, that can also go a long way.
Thank you so much. That is a wonderful takeaway for all of us. So to kind of catch us up to speed where we are so far in this conversation, workplace wellness programs, regardless of what shape or size it looks like in your organization, can identify those at risk and connect them to care. And we know that COVID has really increased something that was already pretty big to deal with prior. Programs to help reduce stress and manage stress and health, they're good for productivity. They're good for the bottom line. And also, I think one of the really important threads that we've addressed today is suicide prevention. And Alex, you shared just, a really recent tragedy that happened within your own organization. And how do you perceive the role of employers to be in suicide prevention?
I think that our society, as a society, we have adopted the it's not my problem, it's not my issue, it's somebody else's issue. I'm not going to get in anybody's business. And I think that I believe that there is a role that we all play on that. I think that when we as individuals, we see signs and we see an individual acting different, we see an individual acting out of the norm, I think that it is our responsibility as humans. I think it's our responsibility as citizens to, even if we get, because it has happened to me, even if we get it's none of your business, at least I checked. And I won't take it personal. But I think that this whole privacy and this whole of it's your problem, I'm not going to get in your business, has a lot to do with the problem that we're having in our society with suicide and suicide prevention and checking on each other. But as an organization, the worst thing that we can do is to punish it. It's to involve HR from a punitive way. It's to say, if you, and remember the word gets around, the word really gets around really fast. So if you encounter in your own organization, in your own company, in your own workplace, if you encounter an individual who has shared, you touch bases with them, you ask the questions, you show concern, and they have shared with you that they have had some suicidal thoughts, the worst thing that you can do is bring HR to the table from a punitive standpoint. And all of a sudden, get that person on an administrative leave, get that person out of the workplace. That's the worst thing that you can do. Because that person, something that might be just keeping them from not committing suicide, it's coming to work every day. It's feeling that somebody depends on them. It's feeling that they're part of a team. So it's a very sensitive subject. It's a very sensitive subject, but I truly do believe that it's all about relationships, and it's all about what's at the core of those questions. Are you really asking because you're concerned, or are you really asking because you just want to gossip?
It is a cultural phenomenon, is it, like within any workplace? And I know when you look at some of the companies and organizations really around the nation, but particularly in the state of Florida, that have exceptional wellness programs at their workplace, suicide prevention is actually something that's tackled just like CPR or just like first aid. There's a very encapsulated type of education. There's several that are out there on the market that organizations, some of them are even free because there's grants around suicide prevention, but it is educating things that we as behavioral health professionals, we know inherently that the question, are you thinking about hurting yourself or ending your life? There's fear that if you ask that question, someone's going to go do it and it's going to put the idea in their head. Actually, it's an opposite effect. We know statistically that if we ask the question, it makes them significantly less likely to actually act upon those feelings, because it's like you've just taken the lid off and brought light into something, and they're now sharing that feeling with someone else. It is a conduit to perhaps finding some hope. And the lack of hope is actually really why people end up committing suicide. Because we spend so much time with the people that we work with on a daily basis, it's really important that we know these sort of things, that we're allowed to have these questions. I love how you said, Alex, that you don't want to necessarily immediately go to HR. It's definitely not a punitive thing. But another really sensitive topic for individuals is sometimes you do need to go to HR because you need to understand more your benefits, or you're having a problem with your mental health benefits, or you need to apply for short-term disability because your care team, whether it be your psychiatrist or your therapist, has said you really deserve and need some time to work on this so that you can come back more ready to do your work. And Natalie, can you really kind of maybe share with us some words of advice for someone who is fearful about going to HR, how they should, proceed with that, maybe some suggestions?
So again, it's okay to not be okay. HR is here to help. What we did at Publix, we actually went through Peace River and we did the mental health first aid class, so we could have those conversations with associates because we're like the front line. They call us first when they need help and assistance and guidance. If they are having mental health issues, they call us. So we need to know how to talk to them and guide them and get them the help that they need, because we're not mental health professionals, but we wanted to be able to have the good conversation and get them help. So just let them know that we're not here to retaliate against you. If you need time off, we'll help you and guide you through that process, whether it's FMLA or short-term disability, so on and so forth. So I really think that the video of our CEO saying that it's okay to not be okay, it encouraged and helped a lot of associates come out and get help. So I think if you all could at your workplace do something similar, let leadership tell their story about mental health, and it'll encourage and open people up more to come and get help.
That is wonderful. Thank you so much for sharing that. I failed to mention to you the phone number to text questions at earlier. I just got so excited, I dived right in. But there is a number up here to text questions to our panelists. And we're kind of moving into those last couple segments here today. Thank you so much for the great conversation we've had so far. But we do have some time for additional questions. For those of you that are on virtually with us, that phone number is 863-888 2911. And again, thank you for the good questions we've had so far. I have a couple other good ones here as well. So Donna, another thing that has really changed for us recently, particularly since COVID, is a lot of team members went virtual. They were working from home, which is very stressful in and of itself because you're trying to juggle a lot of things in your home environment. And now we're returning to the office, which is great, but also weird for many people because there's just so many different things, and people who may not have dealt with social anxiety before, now we have social anxiety for the first time. So help talk us through a little bit about how to manage some of those feelings in that transition.
Okay. Well, if your mind is all cluttered and your area is all cluttered, that plays into it. So one of the things that you can do is make sure that your work area is as uncluttered as you can get it to be. So taking the time to unclutter that, not only while you're doing that little task, it gives you time to process and calm down, but it also will help if your environment is uncluttered. Another thing that you can do is just something very, very simple to help bring yourself down is breathing exercises. And if you can look anywhere that you're at, you could do this and it's not noticeable to anybody else, but if you can find a little square somewhere in your area, it could be a window, it could be your doorway, it could be your computer screen, and just, breathe in as you go up, hold it as you go across, breathe out as you go down, and hold it as you go across. And you could just follow that with your eyes and let your breathing do that. You can calm yourself down in any situation. So, and that's something that we teach young kids in the school system, with just something little like that you can do to just bring yourself down when you find yourself becoming over anxious. And it's not something that is real noticeable that you can do.
Very good. Thank you so much. Now, we also know that many wellness programs, right? We've talked about a lot of the things like how do you help someone in crisis, or how do you know what numbers to call if you're in trouble, but also wellness programs within workplace mental health that really also focuses on prevention, those things that are getting good bits of information out there. And one of them is like good diet, good exercise, good sleep, just overall good physical health does play a part in mental health. Alex, can you share with us a little bit about some of the benefits of physical activity, exercise, and maybe how employers can help focus on that as well?
Well, I'm not a researcher or a physician, but I have read a lot, and I know that when you exercise, the same endorphins that are released in your brain are the same ones that are released for a person that is substance use disorder. It gets the brain to work, begins to let the brain work properly and begin to establish those connections again within your brain. Health is health, and mental health, it's part of health. Mental health, I will say it again, there should not be a division between, let's talk about health, but yet let's talk about medical, physical health, and let's talk about mental health 1 month a year during Mental Health Awareness Month. Mental health needs to be talked about every day and needs to be included in everything. But wellness, diet, I will tell you from experience, personal experience, I personally, in the last 10 years, I have lost about 135 pounds, and it speaks volumes in the way that your brain works. And I always say to an individual, because we cannot talk about mental health without talking about substance use. We can't, right? Because unfortunately, 95%, some people think it's higher, some people think it's a little lower, but 95% of individuals with substance use disorder that's a result of an untreated mental health disorder. So they self-medicate, etc. So, it is so important. Wellness is so important, that goes just beyond your physical, your medical. It goes into mental health. It goes into your relationships. It goes into your interactions. It's just, I'm really optimistic about the new generation that is coming up. I really am. I have an 18-year-old and a 15-year-old. And I'm really optimistic. A lot of people say, well, we're doomed with this generation that is coming up. I really don't think so. I think that this generation that is coming up, that one day will be sitting here, they are the ones that are going to change this wellness, and they are the ones that are going to change this division between mental health and substance use and medical health, because they're okay talking about it. They're okay talking about it, and they see the importance of it, and they learn from each other, and they talk to each other about it. And they have seen how suicide has impacted their generation so much, bullying and things like that. And I'm really optimistic about the work that is going to happen in the upcoming years. But most importantly, you at your workplaces, we see this every day, working in mental health and substance use and behavioral health. This is what we do for a living, right? But that this might not be what you do for a living, you are what's going to change this. You have the power to change this conversation. You have the power to say, no, I'm not going to vote for this individual because they don't care about mental health. Let's make changes, policy changes that say that mental health needs to be at the forefront and needs to be taken care of the same way that medical health is. So you have the power to do so. You have the power as an employee. You have the power as a community leader. You have the power as a voter. You have the power to make changes and to inform the changes that need to happen in our society.
Very good. Thank you so much, Alex, for those words. I know I truly believe that it's all our problem and it's all of our opportunity in order to make an impact and really make a difference here. So make sure you're getting in those last questions if there are any texts. I do have a few here. One question from a viewer was that Polk County School Board is contracted with Hazel Health for students. And so they're asking our panel, are we familiar with their resources? And if so, would we recommend extending these services to the Polk County Public School staff? What a great question. And Natalie, I mean, you really brought on Amwell, I believe, was the partner that Publix really partnered with. Did you feel that there was a good return on the investment when you offered those accessible telehealth services to your employees?
Yes, because it brought awareness to what was available. That's so awesome. Sending out a simple mailer to everyone's house it let them know that, okay, I do have a benefit available that I can utilize. And we did see those utilization numbers go up after that. And especially after the video, the infamous video that our CEO did, the utilization numbers went up as well. So I am familiar with Hazel Health with Polk County Schools only because I have a daughter in Polk County Schools, and I got the phone call saying it was available. But that's the only.
Yes,
I am
Alex.
familiar with Hazel
Oh,
Health.
perfect.
And one of the things that I truly believe that it's not the future, it's here, but it just needs to be adopted more and be grown, is the intersection between primary care, primary medical health care, and behavioral health.
Sure.
And that's what Hazel provides. Hazel provides an integrated care model that when a child it's identified as an individual that may need, goes to the nurse's office, and all of a sudden the nurse starts talking to the child, and the child seems that, suffering from depression or anxiety, or he hit somebody and he's being bullied, etc. That nurse can do a psych consult to Hazel, and a professional and a mental health counselor will get on the line with that student and with the family to then provide that mental health care, or the behavioral health care integrated with the medical health. We at Advent Health, we also have expanded and have gone into with a service that it's like Concert Health.
Okay.
Which is now implemented in every single one of our primary care physician's office and specialist office, that if anything, the physicians are asked to do a PHQ-2 on the individual. And then if it's a PHQ-2 and a PHQ-9 it's an evaluation and assessment for depression, and then for also suicidability, suicidal thoughts, etc. So if that is identified, then they're referred immediately through a telemedicine visit to Concert Health to talk with a professional, where a PHQ-9 is done, and then a treatment plan. It's designed in combination with their primary care physician.
Perfect. That's a really neat conduit. And again, it sounds like a theme that we're hearing about integrating behavioral health services into primary care. It breaks down further barriers if you can kind of have that one-stop, shop. And especially if you have a relationship already with a nurse practitioner or a physician that you trust, if that person suggests to you like, hey, you may want to talk with someone or try something, for really what it is you're dealing with or your stress, you're going to be more likely to agree to that. Donna is our psychological first aid or mental health first aid educator. I got a question for you.
Okay.
So how do we get teen to teen mental health first aid into our schools? And do you feel like that would be a benefit in order to actually put adolescents through that type of education?
Yeah, I definitely think it's beneficial. And the mental health first aid, we also have a teen version of that, and getting that out into the public and helping teens help other teens. A lot of times, they may turn to their friends first, and then them encouraging and knowing what resources are available and how to connect them with the help that they need. It would be very beneficial. So anybody who works with teens or
could have that kind of training.
Yes.
And again, I'm seeing a theme that I want to kind of bring to light, that it's about that peers, whether you're in the mental health community, whether you're in the nursing community, whether you're a teenager in the community. If you have someone that is a little bit more like you and on your level, know more resources. They don't have to be a behavioral health professional, but if they just know like 3 or 4 more facts than the average person in their class or in their peer group, they're going to be of great help. And we need all the help we can get right in Polk County, because we don't have enough behavioral health professionals already. So the more we have these conversations at the dinner table, as Alex said, within our community and our organization, as Natalie has showed, we've really had a lot of good takeaways today. And I appreciate so much the panel. You know, on a personal level, we all have a role to play in mental health in the workplace. And you may even think to yourself, if you jotted some notes down or what have you, like, oh my goodness, so I need to, meditate. I need to take some nice deep breaths. I need to, write some notes of gratitude to my employees. How am I going to have time for all this? Physical activity. How am I going to get my walk in and my 30 minutes of physical activity? What I really want to remind you is that it's just small little snippets that make a difference when they're all put together and collective. If you take time to send a text message or put a sticky note on someone's door today that says, thank you so much, you are doing an awesome job, that made a difference. And if we can create a culture where gratitude is more infectious than COVID, that truly improves mental health in the workplace. Same thing for you. One of my most favorite journaling exercises is actually called the brain dump. And I do it often before I walk into a difficult or contentious meeting, where I just take a piece of paper and I just write everything down, all that clutter in my head. As Donna talked about, the physical clutter of our workplaces, all that mental clutter too. I mean, literally less than a minute, write down the words that are going through, whether they be doubts or fears or concerns, no punctuation, and then throw that little piece of paper away. But if you do that activity, and again, neuroscience evidence has showed us, when you walk into your next interaction, you're more present. You are more aware of the people that you're interacting with. You're more impactful. You're more creative when you're faced with agenda items that don't have a good, easy answer. Same thing with deep breathing exercises. If you take 8 to 10 deep breaths right now, you are actually going to lower your heart rate, lower your blood pressure, and start to influence those stress hormones in your body. If you work that in throughout your day and you encourage other people in your workplace to do small things like that, little educational things, whether it be in a newsletter that are about mental health, resiliency, reducing burnout, those are things that impact a culture and help people start to take care of their mental health in small ways every day that perhaps can turn down the volume when they have a big mental health crisis, because they've already begun working on some of those tools in their toolbox to address some of those things. I know I really focus on emotionally intelligent leadership. It's something that I've learned and studied quite a bit. And one of the things that we love to do if we're having a small group meeting at LRH, I know my team members, sometimes they roll their eyes at me, but we'll start with 2 words. How are you feeling today? I don't want to know anything else, but just give me 2 words. And we start with 2 words because we're really complex people. Like, human beings rarely feel one emotion at a time. I can be really happy, but also really stressed or really worried. I can experience great grief, and at the same time, I can experience great joy. Being complex like that, and if you start meetings, usually with small groups of about 10 or less of your core people you work with on a daily basis, it will influence how you engage with each other, because just by sharing those 2 words about how you're feeling that day, you get a glimpse of what's under the surface. So when you see a deadline not met, when you see someone not speaking up as much or maybe having that change, you're just going to know, I don't know the details and I don't need to, but I know that they're human, and I know everybody else in this room is too. And if we can break down those barriers, and those are just some simple ideas I want you to remember, because this really is a cultural issue that is hard to change. It's like a garden you have to continue to nurture and water day in and day out. And it's something that we all need to do in our county and in our community. Think about our new employees entering your organization as the canary in the coal mine. So as that new employee comes in bright-eyed and bushy-tailed and excited and energized to make a difference, whether it be in the mental health of the community or as a new nurse or a new teacher, how are they going to emerge in 3 months? How are they going to feel? We have to teach our new employees some really hard, real-world, practical things, because we're dealing with such complex issues in our community right now. But we can do it in a way that also acknowledges them, that appreciates them, that helps them create the tools to tackle such hard things and have their mental health intact. These are things that prior generations did not have on their KPIs. Their K performance indicator did not include burnout scales. And what we all need to do, whether you have a formal assessment tool in your workplace or you do one in small work teams, including that is something that you monitor and watch, you will find that the investment truly pays off. So thank you so much again for everybody who participated. Thank you for our dynamic questions. We've just had a wonderful group of panelists today. And I thank you for each of you being committed to improving the mental health of our community, not just in the month of May. As we conclude this third of our 3 sessions, thank you to Ileana again for really putting together and spearheading this. I think it's been a wonderful beginning of this conversation. I look forward to continuing with all of you in the years to come. So thank you very much.